Welcome back to the David Pakman Show. If you have a Twitter or Facebook account, take a second to go to donateyouraccount.com/David Pakman Show. It's a quick, easy way to support the show. It costs nothing. Lewis is doing this daily with fake Twitter accounts he's creating, so it's a huge thing for us. It is now time for the debut edition of Worldview with Denis Campbell. Denis, of course, is editor-in-chief of UK Progressive Magazine and also author of the ebook Lipstick on This Pig. Denis, great to have you. You know, I want to talk about, in the UK, we're seeing a move to some social policy proposals that in some ways are reminiscent of the crazy right-wing social proposals we're seeing in the United States. So two questions on this, I guess, to get us started. Number one, give us a couple examples of these proposals. And number two, is there any evidence that the U.S. Republican right-wing movement is actually influencing some of these UK proposals?
Well, it absolutely is. And indeed, I'll take your second question first. We just had a story break today in The Guardian, particularly in the area of abortion and reproductive rights. There is a US-based faith group here in the UK that has been protesting outside of London clinics, much to the dismay of people here in the United Kingdom. But you asked for a couple of examples of austerity. The two biggest are, of course, in our crown jewel, the national health system. What they're planning to do is some very severe cutbacks to the level of services and to privatize a number of those services to, quote, increase competition. And we've heard that many, many times before. That has been, as you could expect, a real hot button issue. Indeed, the two parties that have come together in government, the Conservatives, the Tories, and the Liberal Democrats, which are the strangest of bedfellows to begin with in the first place. The Lib Dems just had their party conference over the past weekend, and what the party leader and Deputy Prime Minister Nick Clegg was hoping for is that they would turn around and support the broader government initiatives on the National Health Service. They were turned down.
So let's look at that one right there before we go further.
Yeah, sure.
There's kind of two viewpoints on the NHS from the U.S. that I hear commonly. One is that it works incredibly well and the U.S. should do the exact same thing. You hear that mostly on the left. And then the other one is the one that those on the right tend to say, which is you've got people waiting 8 months for necessary surgery. It doesn't work. It's expensive for the government. It makes taxes really high. I mean, internally, though, what's the view of it? Do people like the NHS?
Well, most people love the NHS. And, you know, from the perspective of someone who has been in a U.S. system for a number of years, I spent 6 years in the Netherlands and now 8 years here in the United Kingdom. I've never seen a system that works better. And when the right takes shots at the NHS in terms of level of care and waiting lists, they do not discuss what the real issues are, which is the acute nature of whatever care is needed. Now, for example, I had a retina detach 5 years ago. When that retina detached, I knew it was happening. I was taken immediately to hospital. I was immediately admitted and surgery was performed. What that meant was that two people that were there for more elective surgeries were pushed off of the schedule. I've had that happen to me for elective procedures. If there's an acute need, they're right on top of everything. If there's something else that's going on, you may need to take a number and wait. Now, when you hear 8 months, that is at the extreme end. If you look at issues such as cancer treatments and such, the waiting times are much, much less. And depending, again, on what the presenting symptoms are, it could happen almost immediately. A number of people like myself also take out a supplemental insurance provider in the event that there's something that comes up that is, you know, not a pre-existing condition, which is something you know a little bit about in the States. You can move quickly to the front of any line through private care facilities with this extra insurance that you pay for. It was the same in the Netherlands. We had a certain amount that was covered very specifically under national health care and a certain contribution everybody also was expected to make towards their own health care as well. Nowhere near the numbers and nowhere near the complexity of what you see in the States. One of the first things I had to get used to walking into a hospital was that there are no forms to fill out. They ask you your date of birth and they ask you to verify your address in the computer system. You get your treatments. You often walk out with a nice paper bag filled with whatever medicines you need, and nobody asks you to visit the cashier or do you have to fill in forms or pay any other co-payments, etc. It's the way the system is designed. Indeed, if you are somebody who is advanced in age and even can't get to the hospital, they'll arrange for transport to get you to and from. It's
Sure,
a
yeah, and
fundamental system of care.
a lot of that reminiscent of some of the care available, at least for elderly people in my home country of Argentina, also very reminiscent of that. So let's go back to why mess with a system that presumably is working well? You mentioned increased competition. Who benefits from this so-called increase in competition? I mean, why propose to fix a system that may not be broken?
Well, it all comes under the false meme of efficiency and austerity. The drumbeat that has been going on with this Tory government now since day one is we can't afford it, so we've got to cut back, we've got to cut back, we've got to cut back. End result now is that the United Kingdom has a growth rate of less than 1%, while we look at a fairly more robust growth percent of 3%. Growth rate, excuse me, of 3% in the United States. A lot of these austerity moves were taken to reduce debt, yes, and also because there was the threat outstanding of there being a reduction in our debt rating. Two groups came out just yesterday, Moody's and Fitch, and said that's going to happen anyways in the next 60 to 90 days. So the Tory government is scrambling to try and find whatever means they can to keep advancing their meme and keep advancing the story.
Does this have support among individuals? In other words, in the U.S., very often the most extreme social proposals from Republicans really don't have widespread support. You can find it in certain areas of the country. In the U.K., with these types of proposals, I mean, do people support this type of thing?
They're not supporting it at all. As a matter of fact, what's happening is that resistance is building on just about every front you can imagine. The doctors, the surgeons, the universities have all come out that are providing people that provide the higher level of care firmly against the project. The more you look into the details, the more you see there are a lot of systems being set up to benefit friends of the Tory party, which is no surprise. You're seeing a lot of contributions that are going to end up with contracts for some of the bigger donors to the party. And the nurses' unions are against it. All of the unions are against it. And as people who are patients and users of the system learn about it, they're also coming out against this system. It's not broken. You don't need to necessarily fix it. There are some things that have been done in the past that you can always find efficiencies, but this is one of the things I've always faulted this incoming government for the last 2 years on. If you had done what the United States with Bill Clinton had done and said to Al Gore, okay, you're vice president, Mr. Gore, I want you to go into every single department of government and find the waste, fraud, abuse, and cut it out. Look at the end result after 8 years of a Clinton presidency. When the Tories and the Lib Dems came into power, you have Deputy Prime Minister Nick Clegg, who could have fulfilled a very similar role. But in order to do that, you'd have to take on the dreaded civil service in this country, and nobody wanted to do that or had the courage to do that. Instead, they went on their ideological cuts bent.
So similarities to the U.S., we're seeing these right-wing social proposals. We're seeing lack of support from the public, like in the U.S. overall. In the last 30 seconds or so that we have here, I'm guessing another similarity is unions and labor are going to be hurt if these proposals succeed. Am I right on that?
Absolutely. The unions are in a complete uproar over this. There have been also threats to the pension system, which should sound familiar to your viewers and listeners. Everywhere that they can try to squeeze some money out, they're going to try and squeeze money out of the system. The unions are dead set against all of these austerity moves for a number of reasons. Because the government entered into bad deals doesn't mean you then turn around and take it away from them. And it's a fairly, consistent and logical complaint. We're also more used to having a stronger system of unions and some call it socialism, but there is a safety net here in this country that I don't see really in existence in the States. And to take away and harm that really harms the fiber of the nation going forward.
We've been speaking with Denis Campbell. He is editor-in-chief of UK Progressive Magazine. The ebook is Lipstick on This Pig. We'll take a break. We will come back. Still want to talk about an interesting intelligent design-related lawsuit that's taking place in California. And much more still to talk about, including your emails. Stay tuned.